3.
Okay, Mariam.
Welcome back. You tuned in the Inspired Afternoons with me, your host, Mariam Mia. And now I think this is an important, much needed segment due to the recent uh, increase in people being positively tested. I've got my producer, Zakia, here with me in studio. And I have Aqeela on the line. I've got Aqeela here. Let me just welcome Aqeela as well so she can listen in on the discussion. Assalamu alaikum, Sister Aqeela. Shukran for availing yourself again on Salam Media in our afternoon program, Inspired Afternoons. Aqeela is a psychologist, is Aqeela. She's got, alhamdulillah, she's qualified in neuropsychology as well as clinical psychology and the founder of Neuro Psych Health, and she has an integrative psychological practice, and her aim is all to make psychology accessible to the general public. So alhamdulillah, we've got Sister Aqeela there. Assalamu alaikum and welcome to our afternoon program, and agreeing to take part in our panel discussion because I just needed somebody, especially with your field of study in neuropsychology. You understand how a brain works. When we hear certain triggers or certain information, we automatically hit the flight response, and you need to make us understand and calm us down because, like I said in my introduction, when the pandemic first reached our shores in it, first it was one person, then it went to 5, then it went to 10, and even when there were about 500 cases and maybe two fatalities in it that resulted in death, it was fine. It didn't affect us, and then we got to know of a friend, so it was 5 times removed before. Now it's people I know, and Zakia knows, we know them firsthand that have tested positive. Alhamdulillah, the people around us, they have no symptoms or very mild symptoms, but it's hitting home. It could be every second or third household there'd be somebody who's tested positive, and that's what's happening. Panic is starting to filter through, but more than the panic, it's now stigmatization. So first of all, you have the anxiety of you could be positive or interacted with somebody positive, or you are positive now and everybody's blaming you an irresponsible person, or what you're doing out here. It's so much to take in. I think if the virus is not going to cause us to have the severe symptoms, it's our psychological mindset that's going to bring on stress and weaken our immune system. And that is why we all coming to you. And I felt I need your perspective because you need to have this discussion and calm us down. And then I've got a medical doctor, Dr. Tabassum Khan, and I'm going to read out shortly her post she put yesterday, which was so telling in terms of our social responsibility and avoiding the stigmatization. But before we go there, Sister Aqeela, I've got Zakia firsthand because she had a scare last week in terms of she was in contact with somebody who was tested positive, and she's brave enough. I think she's one of the first people here in the studio that told me, you know what, she wants to share her story because she wants people to come out in anxiety. So let's just bear with her. She's a bit nervous because she needs to share the story, and it's going out there. So Zakia, Jazakallah and Shukr for joining us, and tell us now what happened last week. I know what happened last week, but give us your emotional state of mind last week.
Assalamu alaikum. Jazakallah for having me, Mariam. So basically, about a few days, 6, 7 days ago, 2 of my neighbors actually tested positive for COVID-19. The thing is, they were in and out of our house. It was Ramadan, so we were constantly sharing plates. You know the whole Ramadan vibe, alhamdulillah. But it was very frightening, Apa Mariam. It was very frightening for all of us. We all immediately had to go for testing, and there was a sense of panic that broke out in the complex where I stay. And as much as we didn't, I think it's human nature to want to protect yourself and sort of shield yourself against it, which is normal. But obviously, we also need to take into consideration how they felt. You know, they were also the people who tested positive. They were also going through something major. And as much as we wanted to stay away, we also tried to take that into consideration and take their feelings and their emotions into consideration. So it was a very difficult thing to go through, and I think we need advice. We need guidance as to how to deal with people who are tested positive. How do we sort of deal with us needing to go for the test and so on and so forth.
And Zakia, so yeah, like you say, there's so much confusion because those are your neighbors. You have an interaction, you have a relationship with them, and now suddenly you can't just now the untouchables. They sort of, you have in India that untouchable caste system. This is how people are treating people who have tested positive.
Mm-hmm.
And like you say, you need to be cognizant of their feelings,
Yes.
as well as you being afraid, and then also your social responsibility in terms of that period of not knowing. You have to treat yourself as being positive because you don't want to infect others. So it's just many facets that you have to deal with, and you're trying to find the most responsible way
Mm-hmm.
because that's what makes us human, is our essentially our emotions. That's what defines us and makes us human, is our emotions. So if you're just going to be clinical and sterile to our approach, sorry, you know what, you have COVID-19,
Mm-hmm.
self-isolate, goodbye. I'll see you once you've tested negative already and you're on your own. That is not how human beings react. And also then we had interacted prior to that.
Exactly.
So I mean, now I had to consider this. But I'll tell you personally, I'm not afraid of COVID-19. I treat it as any other illness or virus or whatever it is, and I firmly believe, yes, I have to take my responsibility, but if I get it, then it's from Allah, and I have to deal with it, and I have to be reasonable. And if I don't get it, alhamdulillah, it's also from Allah. All these things will happen. So I have my faith, as well as I'm tying my camel. So I want to, I tie my camel, as the hadith says, but I don't want to hamstring this camel as well. I don't want to hamstring and strangle camel, because I think that's what's happening with the fear and stigmatization. We're not just tying our camel, we're hamstringing our camel. And this is what we don't want to do. So, Sister Aqeela, can you just reflect on Zakia's experience and what she said in terms of this whole dilemma now that you're being faced with?
Assalamu alaikum, everyone. I'm so happy to be here again. Jazakallah for having me. Just stop me at any time if I sound unclear. Okay, so Zakia, I think you've taken a very courageous step, and this is what I was going to encourage the public to do. So, in order to tackle stigma, we have to come together. We have to take an active role in the community. We have to speak out against stigma. Okay, because when we are discriminated against, it can happen in very overt and direct ways, and it can also happen in a very subtle way, right? So when I say overt, I mean people can make remarks or comments about you being positive when they've heard this, or there's a negative attitude or belief towards you, okay, and they can express this overtly. But also it can happen in a very subtle way. So people would start to avoid you, or um, um, so obviously we have to quarantine, we have to social distance. That's our responsibility, especially if you are positive or you suspect that you are positive or you have some symptoms. But I think that it's important that even though we are physically distancing, not to distance yourself in terms of um, I mean, there are other ways to connect with people. Okay, so still reaching out to family and friends and co-workers that you can feel supported by. So, I mean, I totally resonate with your experience. I myself have been for a COVID test, and it was such a scary experience. And I completely, agree with the anxiety that people might face. I was negative, but I still went through very similar thought processes and feelings and emotions. And it was a scary thing. It was a really scary thing. And it was up to me to decide, okay, am I going to let this uh, define my ability to seek treatment? Okay, because often what people do is when they are scared, when they don't know much about what's going on, or they are panicking. When you are in panic mode, I'm so glad, Sister Mariam, that you remembered my fight flight um, piece the last time we spoke. And remember, you are not in actual danger. Okay, your brain is signaling to you that something is wrong, but it's really important to stay calm. To stay calm, look at the facts. Okay, keep informed. Keep informed. It will ground you. It will help to calm you down. Okay, there's a lot of information. This time, I'm not going to say there's a lack of information on COVID-19 and this pandemic. In fact, the opposite is true this time. There's actually a lot of information out there, but the problem is there's a lot of fake information too. So how often do we get so much of broadcasts and videos, and then 5 minutes later, oh no, that's fake news, it's not true. Okay, so this is all sensationalism. It's to create panic that is unnecessary. And I would urge you strongly urge you to make sure that whatever information you receive or send out is done from a credible source, from a transparent source. Okay, so make sure that you're reading things from good sources, from credible websites. Make sure you know who's putting out broadcasts, etc. And I think um, what is a big contributor of creating the panic is that people are misinformed because they are panicking. Okay, and they are believing everything that they are hearing about this virus, right? So it's up to us to educate ourselves responsibly, right? Firstly. Secondly, I think because there's so much of stigma around COVID-19, right? It might hamper your ability to seek treatment. So if you are having symptoms, it's really important that you go out and get tested. The testing process, like I said, is scary, but it's really important to do it so that we can act responsibly. Okay, we can act responsibly. We are interacting with people in our homes that we need to protect as well as ourselves. All right. Um, Secondly, don't let the stigma of COVID-19 create this sense of shame and self doubt. All right. Because it's not just other people who create stigma, it is ourselves who start to believe this and start to feel like, okay, so I'm not taking enough precaution. I wear a mask, I sanitize, but maybe that's not enough. And now this is somehow my fault. Okay. So we tend to turn it inward. Onto ourselves and think that we're not doing enough. Okay, and this is also not useful for our mental health, right? It can be detrimental, in fact. Okay.
Can I just stop you there? Because you said something very pertinent that besides the external stigma, that means from people out there, from the community, you can also perpetuate the stigma and self-doubt. And it. So besides
Absolutely.
the external stigma, that's vital. What you said, something very telling, that we need to be responsible in terms of not creating the stigma and self-doubt from within.
Absolutely. Remember, it is not a personal weakness. Don't take this upon yourself as if it's a personal weakness. I'm a failure. I didn't do enough for my own health. We are doing everything in our control. We need to remember this. There is only so much that we can do. So, why are we complicating our lives and causing more panic and stress for ourselves by turning it inwards? Okay. So, that's
I
really,
like what you
really
said. Why are we complicating our lives? And I think that's something I'm going to use. Can I use your word here? When I have
important.
people who are in a panic mode, I'm going to say, let's be sensible. Let's keep things
Yes.
simple and let's not complicate our lives.
Yeah, we're just complicating things. Let's just relax. Let's just take it easy. I know it's a lot easier said than done. Okay. So I'm going to give you more tips on how to deal with it. But it's very
Okay,
easy for,
before we go there, Sister Aqeela, I've got Dr. Tabassum Khan as well on B
okay.
Live, because remember, we're going to have our panel discussion. So who's Dr. Basum. She's a general practitioner. She studied at Wits, we graduated there, and she's worked, alhamdulillah, both in the public sectors and in the private sector in a clinical setting. Currently, due to her child, so she's got a 10-month-old baby that has sadly been diagnosed with a heart condition. So she's now taken a sabbatical to care for her little one. Inshallah, may the Almighty grant the little one complete shifa and make the journey easy for her. But Alhamdulillah, and then she'll go back. But what stood out yesterday is, let me first just welcome Assalamu alaikum Tabassum, and welcome to Inspired and Salam Media.
Aqeela for having me, Mariam.
Okay, so yesterday I was grappling with this whole, well, not from yesterday, from Friday. These WhatsApps that are going around, the fear and don't go into Fordsburg and Mayfair, and then further north, numbers are increasing, and it's like, sort of like a bloodbath is happening there, but the virus infection that's going on, and there was so much panic. And then when a few people were tested positive, the community sort of turned against them in terms of, you are irresponsible and you are this and that. And then it was a stigma. And I was just thinking to myself, if such a stigma is going to be created, whoever is positive are not going to come out there. They're going to be quiet, and they're not even going to be responsible in terms of their traces in that. And then you wrote this very, very telling message. And it, you know what? Alhamdulillah, I just said it was like a dua answered, that at least from a medical perspective, sense has prevailed. And I'm going to read out this message here, which you wrote. It says, "Dear community, currently not just us, but the whole world is in dire straits with the COVID-19 pandemic and its repercussions. Let us not add to this by stigmatizing those who are affected. Let's rather be supportive and empathetic. It is not something to be ashamed of. It is a global pandemic. It is a viral respiratory disease which can affect any of us. Let's not create fear and stigma amongst ourselves, but rather be responsible. Firstly, let's exercise the necessary precautions as per guidelines set out. Remember, level 3 lockdown does not mean it is now safe. It is merely to allow the economy to restart. Secondly, if you are affected, please follow the required protocol. Consult your doctor, clinic for guidance. Please do not fear stigmatization if you need to inform your contacts. It is in the interest to know so that many can take the necessary precautions and actions in a bid to avoid further contamination of those around them. It is a matter of cooperation and not stigmatization. However, if, you feel uncomfortable to approach your doctor, healthcare worker, there are helplines available for advice. While many of us will be affected at some time, especially now that lockdown levels are lowering, let's take a moment to consider the high-risk members of our community, like the aged, those with underlying medical conditions, young and old. Remember, you can be asymptomatic but still have the virus. Hence, we need to adhere to social distancing rules. It is important for us to protect our elderly and high-risk members and those in need of care. We all have a social responsibility. Let's protect and help each other. Working together, we will overcome this. And this was a very sensible, poignant message from Dr. Tabassum. So, Dr. Tabassum, what compelled you to write this message?
So, Mariam, I was speaking to someone in our community. She's quite active in what's been happening, and I know her quite well. So we were chatting about the whole stigma around this disease and the need to do something for the community. And this is when she actually asked me, won't I just put a message out to the community just to calm them down and help them know that there is help and support around. And that's the reason I actually wrote it out. And from there, alhamdulillah, it's gone to many different community groups, and I'm hoping that it can make a difference, a positive difference.
Yes, already, because there were very, very telling points that you put there to calm. I love what you said, and I think psychologist Aqeela Mahomed, who's with us on this discussion, and she said the same thing as she reiterated what you said. It's about cooperation and not stigmatization. And yes, I think what you said, we have a social responsibility, and Aqeela said we need to be educated responsibly. So it's all about our social responsibility in education regarding the disease. Sister Aqeela, would you like to add to this now?
Jazakallah, Dr. Khan, for that message. I think as professionals, we need to work together and we need to play an active role as you are and as I am in tackling this for our communities. I think it's really, really important that we do so, and I thank you for sending out this message. From a medical perspective. And I'm so glad that you're with us on this panel so that you can help educate people who are watching this from a medical perspective on exactly how to deal with such stigma. And I hope that we can have more discussions like this. And I encourage people to come out and share their stories, talk to medical professionals, talk to psychological or mental health care professionals, and educate yourself as best as you can. Because when you do this, we're grounding ourselves, we're remembering what's important, what the facts are, and then we can act responsibly for our own safety and the safety of other people.
Okay, what we're going to do is we're going to take a short break. When we get back, I'd like both of you to just help us in terms of putting a protocol together so you can think about it. Aqeela, perhaps from you from a mental point of view, and then we'll get Dr. Khan from a medical point of view if you might suspect that you have interacted with somebody who's positive, and then what to do in terms of mentally, and then also in terms of the health guidelines what you need to do, and then further that if you have tested positive, now what do we do from a mental point of view without us stressing and using again your flight response, as well as then once you're positive, do we need to go Tabassum, do we need to go to a medical doctor and visit there, or do we just stay at home, monitor the symptoms, and if the symptoms worsen, then we need to visit. So I left you with some things to think about. Let's go to a break, and then we can just offer advice to all our listeners.
Well, I've been chatting.
Virus. The World Health Organization has declared the coronavirus outbreak as a global pandemic.
Aqeela believes in prevention being the cure, and we remain firm in standing by our commitment to support and help those in need.
The border is closed, so I'm very, very affected. So
they are lacking in the supplies.
I hope government can find a solution.
Our response is to provide hardship grants to those experiencing a loss in income in the months to come, and hygiene kits for the vulnerable at home here in South Africa and Syria and Palestine. Show compassion in the midst of crisis. Donate to our coronavirus emergency appeal now. Be proactive. Be aware. Help save a life. Donate today. Call 031 11 573 or donate via www.pennyappeal.org.za. Penny Appeal. Small change, big difference.
Juicy Medicine Depot Retail Pharmacy.
Welcome back. Oh. Into Inspired Afternoons with me, Mariam Mia, and today we're having a panel discussion on our social responsibility with regard to being COVID-19 positive, as well as destigmatizing the whole virus in the pandemic. So just so that we can become, it's a matter like it was so aptly put by Dr. Tabassum Khan. She says it's a matter of cooperation and not stigmatization. So I'd like to get back to Dr. Khan in terms of uh, letting her give us the process and protocols in terms of if we suspect that we might be positive or interacted with somebody who's tested positive, where to from here? Do we just sit at home and self-isolate and wait for symptoms before we go to a test? Or according to health protocols, we need to go for a test immediately? So can you just guide us through the clinical process, and then we'll get Aqeela in terms of helping us through mentally so that it's not a less stressful process?
So first of all, we need to realize that the impact stigmatization has, it's not only on the mental health, but it also alters patients' health-seeking behavior. Because of the fear of stigmatization, they don't seek medical help early, they hide the illness, or they don't do what they need to do. And in the context of the coronavirus, this can be quite detrimental. So like going back to what Aqeela had said, educate yourself about the virus. Know what to look out for, know the symptoms to look out for. Once you're aware of this, if you develop the symptoms, the first thing you do is isolate yourself, but make immediate contact with your health practitioner. You don't necessarily have to go in. You can discuss it with them over the phone. Every health practitioner has a different protocol in place for their practice, and seek the advice. Remember, not every person affected is going to end up in hospital. Many of us may have it, may just exhibit mild disease, or mild symptoms rather. Some may require hospitalization, unfortunately. But remember, every case is on its merit. So you need to make contact with your healthcare practitioner, isolate, let your immediate contacts know so that they can also take the necessary precautions and contact their healthcare workers, and also be in the quarantine. It doesn't mean if you have symptoms, you need to go for a test immediately. That actually isn't a very good idea because of the incubation period. So when I said educate yourself about the disease, understand the disease, understand the common terms that are used, something like incubation. Incubation is from the time that you are affected to the time that you actually display symptoms. If you test too early, you may not even pick up that you have the virus. It may be a false negative. So the bottom line here is that you need to seek help from your healthcare practitioner. They will advise you according to the merits of your particular case. And it can be taken from there. To get a coronavirus test done, ideally you need to be referred by a health practitioner so that should the test be positive, there's certain protocols to follow in terms of notifying the department in the NICD. So make contact with your health practitioner as a first line.
Can I just come in there, please? So basically what you're saying, if you know you interacted with somebody who's tested positive, in this incubation period, wait for a while. So contact your healthcare professional, and then wait until you have symptoms before you go and test. Because as you've said, we might have a false negative. And last week we had the lab on there, and they told us a false negative is when you've tested the first time it comes on negative, and subsequently you go and test, it's positive for whatever reasons, maybe testing too early, maybe the swab wasn't taken from deep in your throat or in your nose or whatever, and that manifests in a false negative. So probably wait a couple of days and wait and see if you present with any of the symptoms. If we can just go through the symptoms again. I know it said, but just for the benefit of our listeners out there, symptoms are?
Okay, so the symptoms are quite non-specific. They fit the profile of having a flu, for example, but you're going to look out for a cough, for fever, for sore throat, for sudden onset of shortness of breath. Those are the most common symptoms we look out for.
Okay. Thereafter, so okay, let's move on, and let's say maybe after 2 or 3 days your throat feels a bit itchy, or you're feeling like maybe your chest is feeling constricted or a bit heavy, then you contact your health professional again, because like you've said, tell me, do we nowadays there are many walk-in centers. I see a big pharmaceutical chain is now said that they've received funding and they're going to do the test for free if you don't have medical aid, or maybe just a cover that doesn't cover the cost of the test. Can we walk into these centers, or do we need to get just like how you go for any other test for laboratory, do we first need to contact our doctors and get the form first, and then we go for a test? How does that process work?
So ideally, you need to be referred for the test. You shouldn't just be walking in and demanding a test be done. With regards to the pharmaceutical company that's doing the test also, they have certain criteria that need to be met. So there's no way that you can walk into the center and just say, I need a test done. There's actually a number that you need to contact. They put their healthcare workers in contact with you. And if you qualify for the test, then only can you go through. So even if you are not feeling well, make contact with your healthcare worker first to say, look, these are the symptoms I have. Should I come in? Shouldn't I come in? Or what should I do? Because remember, your local doctor that you're seeing knows your history, knows your underlying medical conditions, knows more or less how much at risk you are. Also, if you have been in contact with someone, it doesn't necessarily mean you have it. So, but your first point is to quarantine so that you know you're safe and you're not putting others at risk should you have the virus yourself.
Okay. Then what, before I get Sister Aqeela then to join us, what happens? So before I get to that question, so of late, I don't know if you've seen it, but on social media, Sister Aqeela as well, seen that there are a few places that I think I would call them butcheries now. They've put up a message that a staff member or somebody has tested positive. They've now closed off the butcher and the staff are going for testing. Now, if we frequented that butcher, I don't know, maybe you'll spend 15 or 20 minutes at a butcher when you go, but obviously before you went in, you were sanitized, you had on your mask and everything there. Should everybody's panicking? You know, I went to the butcher this week, I did this, you start panicking. Do we panic? Do we self-isolate? What do we do because we visited now those butchers and they put out this message?
Okay, so like Aqeela said, the important thing is to stay calm. Panic is the last thing that you need because it brings about fear and anxiety. So if you're in a situation like this, first of all, you need to determine whether the contact was significant. So remember, significant contact means you've been in close contact or in a confined space with an individual who's tested positive for more than 15 minutes in a space of less than 1 meter. So again, I know it brings about a lot of fear and anxiety, but speak to your health professional or a nurse, or even if you call a helpline, there's many helplines set up to help you with this, who will actually screen you, ask you certain questions and determine whether your contact was significant or not, and you should be going for a test. Again, it comes down to everyone can't be running for a test at the first scale, because there's things like the incubation period to consider. Amongst others, we also have limited resources. Every now and then you can't be going in for a test because when we actually need it, we're not going to have it. And also it's costly. You can't keep on putting yourself through that all the time. So you need to make sure that you actually need the test. And the best person to help you with this is your practitioner or a healthcare worker.
Okay, let me just go to Aqeela now before we move on to step 2. If you are positive, Aqeela, period, before we get tested, and now we are just quarantining as a precautionary measure for ourselves or self-isolating ourselves, our mind is going to play tricks on us. Naturally, you understand that better than anybody else in terms of your neural pathways and what our brain is going to do automatically. You know, it's almost involuntary that it happens. You know, I wish you could have had a switch here to say, okay, brain, we're going in calm down mode. What do we do in this? Because remember, when you're in incubation and you're quarantining, you have time to think. When you're occupied, you forget about these things. But now you're only sitting there and thinking, what if worse? And why does it always happen? Worst scenarios come to our mind. not positive, nothing. I'll make it through. Yeah, why?
Okay, so I can hear your anxiety too. On this from the way that you're speaking to me. So firstly, I think we need to be mindful of. Okay, so you said that will be isolating. Okay, so this with this pandemic, that's the unique thing about it is that although we are isolating ourselves, right? I'm saying we are isolating ourselves physically because we have to. That's the responsible thing to do. Okay, health wise, medically, but don't isolate yourself in terms of reaching out to people who you feel safe with and who you can trust and you know that you're going to get understanding and compassion from. So your family that you live with, friends, co-workers who you feel close to. Okay, keep connections open in terms of social media, phone calls, video calls, whatever it takes, whatever medium you're comfortable with, as long as obviously you're not in person. If you are in quarantine, right? That's obvious. Okay, so when I'm saying don't isolate yourself, I'm saying psychologically
Socially isolate. Don't
reach
socially
out.
isolate yourself. Mhm.
Yes, you are physically isolating yourself, but socially and psychologically, reach out. Don't keep everything. Don't suffer in silence, is what I'm saying. Don't suffer in silence. There are still ways to connect with your loved ones, with people who you feel you can trust. Okay, that is key because you need to feel supported in some way or the other. All right. Secondly, we need to realize whether you are positive or waiting for your test results or you are waiting to see if symptoms manifest. Um, don't equate yourself as a person to the illness. You do not equal the illness. Okay,
I like
so
what you said here. I want to just make a note so I can even learn this to be a better support system. So you don't equate yourself to the illness.
you
You are
are not.
not COVID-19.
So instead of saying I'm I'm a COVID-19 patient, how about we try and say I have contracted the COVID-19 virus, or I have contracted the coronavirus. And also keep in mind, people have recovered from this virus. Okay, it doesn't mean you must take it lightly, but it's about how we think about it. You do not equal the illness. So when we are stigmatized or discriminated unfairly against because we might be positive or we are experiencing symptoms, it's really, really important not to tie your own identity with this illness. Okay, very, very important. All right.
Okay,
The
and you
other
know,
thing,
when you were speaking, Aqeela, just to interrupt you, when you're speaking here, the other side of the coin, because I want to be that person. So basically, I feel like I want to send out a message to my close family group. So maybe my own children and even my parents and my siblings to say, listen here, if you have been in context or whether you're going to be in the incubation quarantine or now you're positive and you're self-isolating, I'm there for you as your support. Please, you can at any of these stages, please feel free to contact me, video call me, FaceTime me, WhatsApp call me, message me. I'm available there. Whatever you tell me is going to be in confidence. I'm also going to keep you happy. So I'm going to do comedy hour with you, and we're going to laugh and we're going to talk. We're going to reminiscent about our old days. We're going to plan our holiday for 2021. But I want to be, so I want to send that message to my family, even my circle of friends, to say, I'm that person for you. Please, I can be that network for you. So do you think that is also important to offer your support in advance to your close family through your WhatsApp groups? So let's maybe everybody do that. Hashtag support somebody, be the supporter.
absolutely. And I mean, even if that person doesn't want to talk about it, even if they don't want to hash it out or, talk about their feelings, which they should, but they don't force them to. Even if they just want to call you and cry because they're scared, that's okay. Just be there for them. Just be present. It's about being present for whatever they need in that moment. So whether it's talking, crying, laughing, planning your next year's trip, doesn't matter. Okay. And I think it's a great idea to actually make yourself available. Reach out in turn to those family members who are self-isolating and who have tested positive. It's a brilliant
I think
idea.
let's
That's
go
exactly.
with hashtag supporter. Hashtag supporter with a smiley face. Let's go there. Hashtag supporter. I think that's what we need to do, because I think we need more people like that to come out and say who's going to be that hashtag supporter. So let me just get now Tabassum back on. Tabassum, have we got Sister Tabassum there? There she's coming through. Okay, so now we've just introduced something now, yeah, that we are going to be a support system as well, emotionally. But now what I need to ask you, let's now take it further. So now your doctor has said, you know what, you need to go for the test, and you went through the process. Last week I had somebody from the lab to say that it's a swab test for your throat and your nose, which is a relatively simple, not too invasive procedure. I know into your throat, the probing is a bit uncomfortable. So, but then once the results come and now it's positive, what do we do then medically?
You'll either be contacted by the lab or your doctor or both. Because once there's a positive result, we obviously have to notify the Department of Health and the NICD.
Just 1 minute. Tabassum, whose responsibility is that? The lab and the doctor, or is it my responsibility as a patient?
No, not your responsibility at all. The lab and the doctor will take care of whatever needs to be done in terms of notifying the condition. So getting a positive result doesn't necessarily mean a death sentence. Like I said before, it could just be mild symptoms, it could be no symptoms. But the important thing is not to pass it on. So to be responsible about it. Self-isolate, also all under the advice of your healthcare practitioner. Depending on your situation, what comorbidities you have, the plan of action will be drawn up according to that. So generally the quarantine isolation period is about 14 days, but again, it's individualized as per the health practitioner. You obviously in this time need to monitor symptoms. If you're still not feeling well and you feel like my symptoms are getting worse, don't be scared to make contact with your doctor. That's what they are there for. And also you don't need to fear being stigmatized to say, oh, if I tell my doctor, everyone will know. Remember, doctor-patient confidentiality is very important, and that's what we maintain. We're here to help, and that's what you need to do. Reach out. If you're not okay, reach out. Tell your doctor what's happening. If your symptoms are worsening, maybe then you need to be reassessed and maybe may need to be admitted. It all depends on the individual.
Okay, now the self-isolation at home. I don't think any of us have the luxury of self-isolating in a place alone where there's nobody. So if you're going to self-isolate, then you're probably going to be self-isolating in your room. But obviously, if you don't have an ensuite or that, you have to go to a bathroom. And then so how do we do it? What is a safe distance? Even if you're positive, what is the safe distance? So you'll spend majority of the time in a particular room, or you'll find a designated area if you don't have a room. I mean, some people don't even have a luxury of having rooms, so it will be a designated area that would be screened off for a person, right? But then can the person who's positive go into the kitchen and, I don't know, prepare something while everybody, so they say, you know, I'm announcing, I'm going to the kitchen now, I'm going to just quickly prepare something, and then I'm sitting there and I'm going to eat. I need a bit of sunshine, so I'm going to go outside. So can everybody stay clear and let me go outside and just sit in the sun for a while, just to have a change of environment, just so I feel good emotionally. And also if I need to see family members directly, how far do we stay in, and what is it in terms of this actual self-isolating? How does it work?
So ideally not. The further you are from other people, the better. Remember, if you're really struggling and you have a small space, or you can't do the quarantine, there are quarantine facilities which have been set up. But ideally, you need to keep your movement limited. You need to stay within your confines as far as possible. Look, going out to sit in the sun, again, there mustn't be anyone around you. Don't call someone to join you, or oh, stand there, I'll talk to you. Avoid it. Avoid it as far as possible. Quarantine means you're on your own as far as possible. Even going to the kitchen, If you really, really need to and you don't have anyone else to assist you or do it for you, then by all means, but try and keep your utensils and things separate. I'm saying this because remember, the coronavirus lives on surfaces and it can survive on certain surfaces for quite a long time. And you don't want to take that risk. So as far as possible, try and be on your own, keep your things separated from everyone else just for that period until you know that you're safe.
So this is including your own clothing and things like that in terms of laundry. I'm just going to the, a practical logistics of self-isolating because this is going to become a reality for many people. So in terms of the clothing you are wearing and stuff like that, so that needs to be washed separately, presumably in hot water to kill germs and stuff like that. So even that laundry that's been taken out, it needs to be washed separately. Am I correct in my understanding of this?
Look, there hasn't been too much said about that. And also, it hasn't been proven that it lives like in the water you use or whatever the case is. So I don't think laundry will be too much of an issue because it will all be washed, hung out, and then obviously ironed. Remember, when you iron, there's a lot of heat which kills the germs and stuff there also. So I don't think laundry is going to be too much of a problem.
Okay. Anything else to from a medical point of view in terms of when we are self-isolating?
It's important to have a good mindset. This is where Aqeela will come in. And also, like she said, you are not the disease. You've just been affected by it and you will overcome it. There's a lot of people who have recovered. Majority of people have recovered from the disease. So,
okay. When do we retest to see we get a negative now? After 2 weeks, after 3 weeks, after 4 weeks? When do you go? Because presumably only once you get a negative can you come out of self-isolation. Am I correct in that?
So not all patients are tested. Like I said, we do have limited resources. But generally, if you are symptom-free after your 2-week period, you should be safe to come out again. But if there's a need, I know there's certain institutions that don't want you back at work unless you have a proven negative test again, then you might need to. But again, you're going to have to speak to your doctor and weigh each case on its merit. But generally, after you've passed the 14 days and you've recovered, you're feeling better, you don't have symptoms, you should be fine.
Okay, Jazakallah for that sage advice there. We'll do a closing there. I want to get to Aqeela because you've told us medically and clinically the precautions and also guidelines what we can do. Aqeela, now, you know what? It's 2 weeks to think, 2 weeks to do this. How do we keep ourselves positive, inspired, sane? Basically, I'm just how to keep us in that zone. Keep us smiling as, you know what? You look so calm and chilled out. So just how do we feel like Aqeela is feeling now? So how do we keep in that 2 weeks? We're going to have plenty times to think, to reflect, to pray, that's all we're going to have. Time is going to be on our side there.
I think, that's why I'm such a big advocate for staying connected to the people that are closest to us, people that we trust and people that make us feel safe and secure. Okay, so that's the biggest thing. And that's why I look this calm because I'm still very, very connected with my friends, with my family. Especially when I was also, when I went for the test and I was scared, I called someone and I cried because I said it's a scary thing. And sometimes all we need to do is let it out, express exactly.
So it's okay to cry. It's okay to cry. It's good to cry.
It's good to cry. Sometimes all we need is a good cry. And it's easy. That's all we need to express. And it's healthy to cry, actually. It's not, whether you're female or male too, males, it's also good to cry for you. It's not a sign of weakness. It's not a sign of weakness. So as I'm reiterating, stay connected to the people that matter to you. Okay. And then the other thing is share your story. Share your story as Zakia bravely did at the beginning. Share your story, share what it's like. We need to demystify this process. We need to demystify the experience of having COVID-19, whether you're positive, whether you're going for a test, whether you're in quarantine, waiting for results, whatever it may be. Share your story, become active community members, okay? If this is not something that you want to do, you don't want to share your story, I am in the process of But let me say, if you don't want to share your story publicly, I am in the process of organizing free online support groups for people who are struggling with COVID-19, who are positive. Okay, I think we mustn't underestimate the power of connecting with other people who are experiencing the same things that we are. So if you are a positive patient and you want to connect with somebody else that's also positive, it is so powerful to when you can actually relate to someone who's also struggling with a positive diagnosis. Okay, and
Sister
together,
Aqeela, that's so profound. You know what, that is such a brilliant suggestion. That creating a positive support group, mashallah, like you say, online, and I commend you. And please, just message us or keep Zakia informed in terms of how the support group is going, as well as, in terms of your research results, in terms of how it helped a positive mindset that you could share. And also, this creates a powerful relationship you can develop with somebody. Often relationship, positive ones, get cemented through also adversity. So, in develop a relationship with adversity, it cements, and this relationship, this is somebody who you don't know. So it's even easier to connect and discuss with them, because there's no viewpoint in terms of judging you, knowing your background to make a judgment call as well. This is just somebody who is also just going to empathize with you and just be a support base. I thank you for this, and also if you can give us details there. But I've got a few questions here. I think this one here is from let me refer this to Dr. Tabassum. How do you isolate a child? If a child is tested positive, it's gonna be difficult. How do you then isolate this child? This is from Sister Fatima Jogi. And are kids at risk if tested positive? From Brother Mohammed. So let's just deal with these two questions, please.
Okay, so to answer the first question, yes, to keep a child constrained or in a confined space is quite difficult. But again, you're going to have to adapt your home environment. Put them in a place where they're comfortable. Maybe isolate 2 rooms for them if you can. Maybe their playroom and where they sleep and eat, just so that it also doesn't negatively impact their mental well-being. And it makes it easier for them to cope and adapt. It's a matter of just adapting to the situation, unfortunately. The flip side to that is that a lot of kids who may be affected might not even manifest symptoms, so we may not know that they actually have it. Kids have been affected, but they haven't had very severe illness from it.
Okay, so I've got a question that's also closer to home, because I know of somebody who's tested positive, and they've got maybe a child under 3. So the result came in, I think, maybe yesterday. And now, do you recommend does the child go for testing under 3, or do we also wait, as you have said, wait for symptoms to manifest before you put the child through going for a test?
The incubation period still applies to everyone.
Mm-hmm.
So it's not a matter of rushing for a test. You have to wait a while. But get in touch with the child's pediatrician. I don't know if the child has any other condition, is on treatment for anything else, is high risk of developing any complications. It's difficult to tell. But again, even for a child, you wouldn't just rush for a test. The incubation period still applies. And obviously the affected person needs to stay away as far as possible from the rest of the family. The quarantine applies to the affected person.
I think the greatest challenge then we're going to have is, especially with maybe children under 6, because that gap in terms of self-isolating them. And okay, so if a parent is positive, and then let's just say the child under 6 is positive, they can isolate together then.
Yeah. Yes, they will be able to.
Because I think that's going to be going into the future, something to think about in terms of children under 6, especially maybe your under 4, in terms of getting them to isolate. I think then one parent will probably just have to take enough personal protection equipment and be with the child. I think that's what parents will have to do then. make a conscious decision to say the rest of the siblings and one parent is going to be away, and one parent will say, okay, then I am going to self-isolate, and if I contract it, then I don't know. We'll just have to, then one will just have to make the sacrifice.
It's a good
I'm just
idea
trying
for
to
every family. It's a good idea for every family to have a plan in place to say that, look, if one of us is affected or infected by the COVID, what is our plan? How are we going to self-isolate? Who takes on what responsibility? So that if you're faced with the situation, you're not facing another challenge in terms of how are we going to handle this. You sort of already have a plan in place. Look, if so-and-so tests positive, we're going to use this area of the house, so-and-so is going to take over that responsibility. It just makes things a little bit easier. I agree that with a lot of things, we're just going to adapt as we go along, but have a general plan in place. It just will ease the stress, tension, and anxiety around it.
So I like what you said. So I think everybody listening, and for all our listeners out there, I think it's time now, maybe in this next 2 or 3 days, to actually sit down as a couple, include your children in this decision-making process, because I think that's part of understanding it and destigmatizing the whole thing is if they are part. This is from a childhood development perspective. Now I'm putting on my head to say, for me, it's important that your children, as soon as they understand, so from 3 and 4 years old, have a family discussion, have a roundtable discussion, make them part of the decision making process, include them and tell them this is what we're going to do. And in fact, for maybe the 10 years and above, or even the 9 who draws, ask them, everybody create a plan. So tell them, you all take this, create a plan. If we need to isolate, how are we going to do it? How can we demarcate our areas and that? So make it a little assignment project in this. So you empowering them in that way, they're going to want to find out more about preventions and the risk, and also reviewing literature for themselves. Just as they do with any assignment or project, let this become a work in progress and a plan of action, because they will feel important as well. So I think children need to be included instead of you having a discussion and telling them, because that's going to bring out fear in them. If they included in this process, it's going to take away the stigma and the fear. Am I correct in this thinking, Aqeela?
Absolutely, absolutely. So secrecy, so secrecy is not going to be very helpful. It's going to create intense fear, and especially it's going to create unpredictability. And this is going to just perpetuate the problem further. And this is not what we need to happen. Okay, so as soon as you are transparent, you are honest, you're demystifying things for your kids as well, and you're sitting together as a family, everyone is on the same page, answer your kids' questions. And the only way that you're going to be able to answer your kids' questions and to relieve their anxiety and their fears, especially because they've got so much going on with online schooling, etc., and that unpredictability, is to be informed yourself. Okay, if you are uncontained, if you are anxious as a parent, your children are going to perceive this, and you are going to perpetuate it in your own homes, and then obviously out there in the public sphere, which we are trying to avoid. So absolutely.
Jazakallah. I've learned so much today, and just speaking to you, alhamdulillah, things came from my mind to the fore in terms of better understanding and that. So you know what? I'm so grateful that we were given this both of you availed yourself at such short notice to come on and just give us sage, proper advice. Jazakallah for educating us responsibly, Dr. Tabassum Khan, as well as Sister Aqeela, because I think mind, body, and soul, it's all round informed decision in wellness, and it's going to be, like you say, having a plan of action, be armed with correct knowledge, important knowledge, and also maintaining that relationship with your health practitioner, getting that support. So the hashtag support, be that supporter, and put it out there to say, I'm that person, I'm going to be that supporter. I think that's what I'm going to do now. And Sister Aqeela, will you give us some details afterwards, which I can share in terms of once the online support group of people who've tested positive is up and running, because I can then just announce those details for our listeners on air. But shukr, I really, really appreciate your invaluable, essential sage and sound advice. Jazakallah to you, Dr. Tabassum Khan, and Aqeela, clinical psychologist Aqeela Mahomed. Anything in closing that you'd like to add, Dr. Khan?
Remember, if we can work together and we all cooperate, we can definitely get through this. This too shall pass, inshallah.
Ameen. And I'll leave the final words to Aqeela.
No, I reiterate what Dr. Khan has said and what you have said. So really, really important. Let's stay connected. Let's come together as a community to play an active role in controlling the disease before it controls us.
I think that was really a conclusion. Let's control disease before it controls us. And thank you for inspiring us that inspired this Monday afternoon. Until tomorrow, Assalamu alaikum wa rahmatullahi wa barakatuh. Stay safe and be safe.
Wa alaikum salam.
Wa alaikum salam.